Welcome back. We're going to be working with the IFR technique now, and the first part of the technique we're going to work with is the 2-point for the diaphragms. Now this sequence was taken actually from craniosacral protocol, and the reason is not only to target the respiratory diaphragm, but to target the other concave and convex compartments. These compartments are basically transverse in nature, and they are part of a very strong connective tissue structure that we saw with vertical, horizontal, and circumferential orientation. What's significant about this is really kind of the grounding into parasympathetic response. The protocol I'm going to show you can be done independently of just doing the handholds as I show them as a one-off, or you can use this, as we're going to show, as a full protocol. So we'll begin. The two-pointing, and with the diaphragms in particular, because it's not just the diaphragm of respiration that we're interested in, it's basically to understand that these compartments play a part, and often manual therapists really don't recognize that. So we're going to begin with the 2-point of the abdomen, and the reason my hand placement is here is because the vagus nerve is the main nerve of parasympathetic innervation. So we're going to sit here for a period of time, and the bottom hand, which, because I have an airbed, is placed so that the fingertips tend to straddle the other side so that the tips are really kind of in that lamina groove area, but not pressing. It's just very relaxed. Mark will feel as if there's really no pressure on his bottom hand. And with an airbed, you can see I can do some movement, and this will make it be important when we actually go ahead and try to change the tissue. But right now, the first step is parasympathetic response. So we're going to watch Mark's eyes, and I'm also going to monitor his respiration. And normally what you're going to feel is the low back starting to settle into the table. How long do you hold these handholds for? Well, sometimes it's as little as 30 seconds, sometimes it can be up to 5 minutes. Remember, this is to initiate a parasympathetic response. Therefore, we're waiting for that sympathetic tone to drop into parasympathetic. Now, what Mark is probably feeling, or he'll have a fairly a variety of sensations, and because no one of us are alike, the manual therapist really has to use their own body to describe what's going on. But usually pulsing will kick up, there'll be a sense of streaming, a change in heat. A number of those are the signs and symptoms that you as a therapist can pick up. The other thing I want you to do, as I adjust for a moment and place my hand back on, I want you to hold the image. If you've done this as a child, you placed your hand perhaps on a basin of water and you just let it float. Just feel that floatiness of the hand. That's exactly what I want you to do with this. Just let the hand float. And you can feel how that changed a little. That little sense has almost as if the hand's not pressing, and it's just riding the breath. Now, what will typically come up with this is autonomic signs, as I said before, and one of them on the abdomen is peristalsis. And with peristalsis, people will say, oh, my tummy is rumbling because I'm hungry. Well, that's only one indicator of peristalsis. The manual therapists, when they use light touch, especially in this area, will initiate when the body responds and relaxes. Peristalsis becomes one of those indicators for us. So we're going to sit here. We could sit here for much longer, but I'm going to move along to the next handhold. And what we do is we take the top hand and we begin to bring it like this. And if you look on the left, you'll see that there's a long, narrow muscle that sits between the respiratory diaphragm and the ilium, and that's your psoas muscle. So one of the things I do before deep tissue is I'll just sit on top of that muscle with my intent and just let the body relax. And notice I have full arm contact. Don't be afraid. A lot of therapists are up like this with the elbow up, or they're straightened like that. You will not get any success if you're holding those hand positions. You must be relaxed. And so what's slowly going to happen as I organize that, my bottom hand will come out and just shift up a little higher behind the respiratory diaphragm, which is circumferential in nature. It's 360 degrees. So you will feel the abdominal pulse come up, but you just sit with that. And as you can begin to see, because of the airbed, I can give some rocking motion, which is certainly desirable if you need to, but nothing aggressive, just really easy. Mark, you want to relax your jaw slightly, that's it, and take a little deeper breath. Now, you're going to get a little sleepy after this work, that's good. Okay? And you may find it a little difficult to follow instructions, that's normal. Okay, so if I have to repeat it twice, it's not your fault. Okay? All right. So as we sit, the other thing is, because I have a little bit more air in this bed than I like, it's a little up that way, but I'm going to just push my hand down, and slowly what's going to happen is I'm going to begin to inch up and work around the diaphragm. Now, this also is a precursor then for any deep work that when I want to engage the tissue. But remember, primarily, this is about parasympathetic response initially. Later, these all blend together seamlessly for you, so that what is a first step in teaching becomes kind of, I sit, I assess, ease, and bind, I engage, tissue changes, I back off, I check release, I move on, I sit, and so on to each hold, so that after a while the client certainly wouldn't know that you were breaking this up into assessment, technique, and reassessment. Now, he's just beginning to slow down. He hasn't glazed up yet, but I think even he can acknowledge that he's just starting to sink a little bit in the table. This probably took us a couple of minutes, okay, at least. People are running from their lives and jumping onto the table for a massage, and the manual therapist knows it takes a bit of time to bring them out of that sort of rushy nature, so that finally they're in their body. When you have them there, that's when the work really can begin. And once you've done the 2-point here, and you're working the psoas line, and you started to focus on the respiratory diaphragm, you can begin to move up to the shoulder area, which really becomes our beginning technique for any of the shoulder work that we use. And you can rest just like this on the shoulder. Now, in a moment, I'm going to show a midline hand hold, and obviously we want to remember that with women and breast tissue, we're going to have to negotiate, one, permission, and two, it's an intimate handhold, so they may or may not want that to occur. And for that effect, a man may feel that way as well. But we're going to show it anyways. It'll be your choice whether you use any of these techniques. So what we're trying to do here is also part of what's needed is an intent or a visualization of structure. If you don't know your structure, then you can't really visualize it. Short of doing a live dissection, which would basically end this gentleman's life, we probably have to visualize that we're going through. So the hand, understand that when we hit the pectoralis tissue, and we can see our pectoralis tissue up there, there's both a surface and a depth. And what we don't know under that is we have the organ of the upper lobes of the lung. So we can sit with that, and we also then have this diaphragmic continuity. Now, the reason we're working this, if we were to do thoracic outlet or move into any of the impingement or occlusion symptoms, then this is a good starting point for relaxation. So one of the things that we also want to talk about is the angle that we go ahead and what we do with the throat. You want to be very careful that you're coming up in an area that is flat to the surface and you're not going to dive in. The other thing we want to talk about is that we need client compliance. And what I mean by that is there's a tremendous amount of issues that people have that you may not know about. They're going to be very protective of that area. So we're going to ask Mark to do several things before I touch. One, I believe I have permission to touch your throat.
Yep.
Okay, number two, Mark, as you take a deep breath, the whole time that I'm there, I want you first just to wet your lips, just swallow, and for one moment, show everybody your tongue, stick it out and put it back in your mouth. Go ahead, do that. Stick it. Okay, and put her back. Good. Now, what that means for you guys, I know it sounds a little silly, but what we're working with is, as long as he knows he can do that, and I ask him to do that, his whole concentration and intent won't be on my touch. It won't work unless they're relaxed. So, without further ado, I have permission to go ahead. Now, you also see the head angle. What sometimes we have to do is even drop the head a little flatter. Now, you don't have to force it. You feel how that just took a little bit out of it. So, Mark, I'm going to touch your throat, and as I touch it, I'm going to ask you to swallow, and if you need to wet your lips, okay? Beautiful. Now, the thumb and the forefingers, you can curl the thumb and rest. You can have a single side forefinger, but no matter what you do, you're going to hang on the larynx. Now, we're calling this the hyoid. Well, of course, the hyoid is what? A little higher and a little wider, and that could be a very choking sensation for that individual. So we're going to ask you to go ahead and just rest lightly on that hyoid area. That's right. And as he begins to take a breath, and my hand is floating, and we're relaxing, and he can swallow, you'll begin to feel in a little bit of time sensation will probably pick up. Now it may take a while. Here we go. Now the blood is going to be, we won't get a shot of this probably, but what that means is normally you're going to view the carotid really pulsing, and you will feel that, so don't worry about that. What you're going to look to do is, as you begin to feel this area relax, and it's loaded with hyoid musculature, by the way, you have the supra and infrahyoids, if it relaxes sufficiently, I should be able to get translatory motion. Now, we haven't cleared a lot of lines yet on Mark, so I don't expect his larynx to move side to side very well. We're getting a little tiny click, but that's what we'll do. You can hang out there for quite some time. And later in the advanced courses, we go ahead and look at those areas again and do a little more technique. But at this point, it's nothing more than touching. If for whatever reason that they're not comfortable, then you can take your hand off and place it almost as an energetic hand so that they feel the warmth of your hand. That will still work as well. So now we're going to proceed to the cranial base. What I'm going to do with the cranial base is take a pillow out, and I'm going to become his pillow. Both hands are going to sit comfortably so that the bottom part of the hands are going ahead and sitting, and I'm going to turn Mark's head gently so you can see the hand position. So that you're just comfortable, and make a nest. And in fact, Mark, I'm going to discard this pillow and give you this one back. Beautiful. Head comes down. Take a lovely breath. Now we call this the rescue remedy hold. So what the heck do I mean by that? Well, if you have a perturbation in the system, if you have upset, you'll be sitting with the individual and placing your hands in a manner so that they're just comfortable. If they have a lot of headache, anything like that, you're going to want to just relax them, and this is the place you can do that. And your intent is just really to draw out some of the tension and vibration. You will feel a lot of almost electrical activity in the head. So we're just going to sit with this for a second. And normally you could sit in this hand position for at least 5 minutes. We're certainly not going to do that. The other few things to add before we move on to the lower extremity is going to be that if you do any cranial work, you can see the seamlessness of just shifting your intent. So I'm still nervous system, and orientation is fascia. But the beauty of this hybrid work is that you can shift it into another domain. You can shift your intent to a cranial rhythm. And I'm sure the cranial folks can see that to be the case. Often we can put our thumbs around the sphenoids. I can also, this is going to be to lead me into going ahead to do anterior work this way or to work into the jaw. So it's a great handhold, and it finishes our upper two-point sequence. And we're going to move in a moment to the lower extremity protocol for two-point.